We can't see each other, but we're here together, and I wanted to take the opportunity to thank you for joining us today. I'm Vicky Sturgopoulos. I'm the Vice Chair of Clinical Programs and Innovation in the Department of Psychiatry at the University of Toronto and the Physician-in-Chief at the Center for Addiction and Mental Health. It's my great pleasure to welcome you all to today's Mindfest presentation. I would like to begin with an acknowledgement of the land on which we work, study, and live. Before I read it, I want you to take a moment to situate yourself and think about the land under and around you. We recognize that many indigenous nations have long-standing relationships with the territories upon which the sites of the Department of Psychiatry are located that precede the establishment of the University of Toronto. We acknowledge our presence on the traditional territory of many indigenous nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, the land is home to many diverse First Nations, Inuit, and Métis people, and we are grateful to have the opportunity to live, work, and gather on those territories. We acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. Since the event is virtual, a singular land acknowledgement does not capture the richness of our distribution across many locations. We must remember that land acknowledgements are only a starting point for larger conversations. More concrete acts of restitution and transformation are needed to address underlying inequities and blatant discrimination in the distribution of resources between Canada's First People and settlers. Today, my colleague, Dr. Andrea Levinson, will be speaking about resources and strategies that can help you care for your mental health. Dr. Levinson is an expert in youth psychiatry and the founder of an early intervention clinic at CAMH for young people with new onset bipolar disorder. As the Psychiatrist-in-Chief at U of T Health and Wellness, she is responsible for the provision and management of psychiatric services to U of T students and acts as a resource for the university community on mental health issues across the campus. An active faculty member of the Department of Psychiatry since 2007, she is a passionate educator of residents and medical students. We are thrilled to have Dr. Levinson join us today, and I would like you to invite me in welcoming Dr. Levinson so she can begin her talk.
Thank you so much, Vicky, for that kind introduction, and welcome to everyone who's joining us today. Thank you to the Department of Psychiatry for hosting Mindfest. And this year in the virtual format, it's really a privilege to be here. I hope that this next hour and a half feels relaxed. I'm going to present some key ideas and themes around student mental health. And then we will have some time for discussion. And I know the chat function and our supporting team here today will assist in collating questions. And I hope we can have as good a discussion as we would have had in person. My slide is not progressing. Just a little technical challenge. Oops, there we go. Okay. So my disclaimer slide is just around some grants that support me. I don't have any commercial interest relationships. And I should acknowledge that my bias is that I'm an advocate for youth, and I'm an advocate for anyone with mental illness or substance use issue. And it's my opinion that those that struggle with mental illness are the most resilient people I know in society, and they are also most likely to speak the truth. So this is a slide from one of my favorite poets, Mary Oliver. this is a quote from her poem, "Tell me what it is you plan to do with your one wild and precious life." And I often use this slide because it always feels like it epitomizes students who I work with on campus and the opportunities that being young provides. There's a whole future ahead of one. I'll read a little bit more today from the poem. I don't know exactly what a prayer is. I do know how to pay attention, how to fall down into the grass, how to kneel in the grass, how to be idle and blessed, how to stroll through the fields, which is what I have been doing all day. Tell me, what else should I have done? Doesn't everything die at last and too soon? Tell me, what is it you plan to do with your one wild and precious life? And I'm not equipped to interpret this for you. Each person will have their own reaction to the poem and to the quote. But as I read the poem, I know how to pay attention. I know how to be idle and blessed. I think it's particularly poignant this year, having been through a year now of COVID-19 and the pandemic. I think we've all learned in terms of our own mental health how we can seek nature. We can seek nature close by because we haven't been able to travel very far. How we can look for opportunities to feel grateful, to feel blessed. And I know that the pandemic is and has been on all of our minds for the past year. And while I will talk a little bit about some COVID-specific issues later on, I'm going to start with some background around the landscape of youth mental health, which is my area of work. And I'm going to start a little bit with my own story and how it's connected to mental illness and the notion of stigma. Then I'm going to cover the mental health, mental illness continuum, touch on mental health literacy and the needs of youth today as they're transitioning from high school to the university or college environment, and then talk a little bit about youth and mental health in the context of the pandemic. So this is a photo of a beautiful suburb in Cape Town, South Africa called Camps Bay, where I had the good fortune to live for the first few years of my life. And at the same time that many students are studying at university, in their undergrad years particularly, I was a music student. And my father, who'd struggled with chronic physical illness for a long time, he was treated with medications that uncovered a mental state that he struggled to shake. And he became very ill. He was very frail, and he was mentally broken. And his sense of reality shifted. He was suspicious of those around him. He walked under what we would call a cloud of psychosis. He heard people talk to him. He needed to access psychiatric care and treatment. And at that time, I was a young university student at the time. My family and I were not included in his treatment decisions. We weren't made to understand what was happening to him and how he would recover. We didn't have a guide. We didn't have any hope. We were in the dark. And as a young emerging adult, I really struggled to understand this shift in him. He was a different dad to me. I didn't know how to interact or support him or console him. And my family's attitudes and actual intended behaviors towards him embodied many aspects of stigma, involving ignorance, for one, with desires to make his mental illness potentially invisible. And we weren't able to give his illness the value and understanding that he needed. So how do we see mental illness today? And we often still see it as a burden or as a weakness or as something to be feared or topics avoided. And people can be disinclined then to seek the help they need or to give the help that is needed. And those who do seek care often don't find the support they need, whether it's in their school, within their family, in their workplace. This is a slide that I like to show, which really speaks to a socioecologic model. It's the Bronfenbrenner Model. And it speaks to all those aspects. In the large outer circle, you've got the green macro system of society. And then you have the blue exosystem of our community, be it politics, our neighbors, our social services, our media, Moving in, we get into the purple, the organizational system. And that would be like our university or our school. And then we have the yellow, which is the interpersonal system, our relationships with healthcare providers, with our family, with our peers, with our religious affinities. And then in the very center, you've got the individual. We're not going to talk about the whole larger system today, but if we think about maybe a young student who identifies as LGBTQ+, their mental health would be influenced by their interpersonal relationships in the yellow, how supportive their family is, for instance. On the organizational level in the purple, their religious affiliation may be more inclusive of them than others, right? And at the community level, in the blue, it would be different for them if they lived in the GTA in Toronto versus a rural community in small town Ontario. So this is a Wi-Fi diagram, just like the Wi-Fi sign, that came out in the early 2000s in our framework in Canada, thinking about student mental health. And you know, me as a psychiatrist, I work a lot in the lower dark green area. I work in supporting students in more crisis or in service delivery and mental health services, and students often with a mental illness. But we need to think about our student body, and many of you may be at high school still or even earlier on. Many are approaching university, many are, have completed schooling in the audience. But we think about the needs of all students at the top, very important. How our organization supports their mental health in planning and in policy and in how the education is delivered. Our culture, our mental health culture, and how aware are we around mental health issues. Then in the middle, we've got the definite need to support those with more emerging concerns. They may not be mental illnesses. They may be symptoms of concerns around coping or concerns around sleep or attentional difficulties or just managing their day, managing their mental health. And in the lower end, as I say, is getting into the area where I'm situated most in my day-to-day work. I always like to bring the mental health illness continuum model into my talk. This is Corey Keyes, a sociologist and a psychologist from Emory University, and he describes the 2x2 dual continuum of mental health and mental illness, and the many stages between flourishing and languishing. And languishing implies some degree of mental health impairment that interferes with our functioning. It doesn't necessarily mean there's a mental illness present. And at this state, it can be limiting to an individual as a diagnosable mental illness. Conversely, those with a diagnosable mental illness can flourish, experiencing very positive mental wellness. So when we talk about mental health, we're talking about a state of well-being where someone can cope with the normal stresses of life. When we talk about mental illness, it's a diagnosable illness that results in impairment in functioning. And it can be due to a number of factors: biology, psychological factors, developmental factors, and it can be managed in many, many different approaches in terms of prevention, diagnosis, treatment, recovery work. And some of us will face far more challenges during their schooling than others. Some of us will develop a mental illness. And I know students with mental illness are among the most courageous students that I've met, and they're navigating adversity and health issues while they attend school. So some of them who have a mental illness can actually be found in the left upper quadrant, in the flourishing, thriving wellness quadrant. I think of a young man who I've worked with who has had a mood disorder and has had suicidal ideation at times, is currently in that top quadrant, thriving and flourishing and doing very well in terms of his mental wellness. And then down in the bottom right quadrant, you can have an individual with no mental illness who's languishing, who's not coping, who may be lonely, who's using substances to cope, who's really disliking his program at school. So mental illness doesn't mean that life is going to be bad. And not having a mental illness doesn't mean that life is going to be good. It's much more complicated. And where we fall on this continuum, wherever we fall, it's important to pay attention and attend to one's mental health. And as much as you care for one's physical health and your body, we have to think about caring for one's mental health. And some of the very intuitive, basic things are really, really important to keep reinforcing and finding ways to approach them. And this has been very, very hard, particularly in the last year in COVID. Exercise, nutrition, sleeping enough. And when one's a student, that can be hard. Using alcohol and drugs in a less intensive way. Having a social life. It hasn't been easy in COVID. Reaching out for help. And so that line between those who don't for now intersect with mental illness and those who do is very fine. It's very tenuous and it's changing and it's dynamic. So there's this continuum that we can all move back and forth along. This is a slide around the link between health and, of course, mental health, literacy, and the real opportunity that actually being at school offers. There's this intersection between mental health and learning. And I'm very interested in our population health, in the epidemiology of mental health, and the social determinants of health. And we really need to recognize how education actually influences health, and health influences education. And actually, there's data to show that health and mental health literacy, how aware you are of your mental health, is a stronger predictor of your health than income or socioeconomic status or educational level or ethnicity or race. And when you have weak mental health competencies, you actually tend to make less healthy choices. You maybe engage in riskier behavior. You may ultimately land up having more hospitalizations. So we have a lot of opportunity in our schools and on campus to make a big difference in building mental health literacy. So there are a lot of challenges, but there are a lot of opportunities on campus. Moving into the sort of challenges, this is a bit of a sensational media slide, just showing you various quotes where crisis on campus sort of hits the headlines. And this typically happens every fall when the school year begins. And, quotes around, are our youth overwhelmed? Are services overwhelmed? What's the solution? And despite no evidence that the sort of prevalence of mental illnesses has changed over time, we do know that our youth are expressing a lot of extreme distress. And I'll talk a little bit more about that in a minute. This is a cartoon, and I apologize if the writing is very faint. And basically, I am a mother of 2 university students myself. And I guess I would have liked to have, been able to say, go to your room and stay there until your cerebral cortex matures when they were a little younger as late adolescents. But, that isn't an option. And so what it's alluding to is the biology. So the brain fully develops by about the mid-20s, and the prefrontal cortex is an area that is the last to fully develop. The subcortical structures that govern more sort of basic needs, fight and flight, they're more fully developed earlier on, but the prefrontal cortex that governs things like judgment and impulse control and planning and what we call executive functioning, looking at things in a more sort of planned and systematic manner, takes longer to develop. So our young people, and I'm 30 years older, they have incredible passion and ability to maybe think even more creatively and outside the box. We lose that as we get older. but there are areas around sort of just being naturally more sensation-seeking and more impulsive that are very natural, because that's just a part of brain development. This is a slide that really highlights this developmental time frame that we like to call emerging adulthood. The other term is transitional youth. And Jeffrey Arnett is a psychologist who coined the phrase and wrote the paper. And if you look at this, it's really it's a phase with very unique features and developmental opportunities and challenges, and it's changed in the last 50 years. And it's typically between the ages of about 17 and the mid-20s. Some people extend it into the late 20s. So if you look in the bottom right corner, in 1960, about 33% of the population attended university, and they were mostly men. And now this is American data. In 2013, 70% attending university or college, and mostly women. And actually the data shows in Canada now, in the current time, more than 80% of our youth are engaged in post-secondary. In the upper right quadrant, you can see that between 1960 and 2013, the average age of marriage for women and men is delayed by about 7 years. And in the bottom left, the number of children has moved from, on average, about 3.5, which is obviously a statistical number, to 2, and childbearing occurs later. So there is this new phase of transition between being a child and being an adult. And if we think about some key statistics that are relevant, 75% of mental health disorders actually do begin before the age of 25, and about half begin before the age of 14. And we know 1 in 5 of our general population will experience a mental health issue or an illness per year. And our young adults and those in their early working years are affected at higher rates. We know suicide is the second most common cause of death in our emerging adult cohort, second to accidents in Canada. Even though suicide is still a rare event, about 1 in 10,000 in youth, it is the second leading cause of death. And we know that less than half of students actually receive the help that they need, which is something we need to work on and improve. I'm just going to flip. We don't really need that slide. So this is just a graph showing you the number of Canadian students enrolled in university and how it's increased. In 2000, there were about 1 million students enrolled. And in 2016, now 5 years back, about 1.8 million. So a huge increase in the number. And I bring this slide up, the notorious and quite provocative Netflix series that came out, 13 Reasons Why, and had actually not good influence on youth and thinking about mental health and suicide acts. But I bring it up just as a frame to talk about maybe why we are seeing more students reaching out and presenting with mental health distress on our campuses. And I don't have all the answers. We don't have a full explanatory model, but these are some of the ideas at stake. So we know now from that previous slide I showed you, most of our youth go to college or university. And it'll be interesting to see as the pandemic, as we move through it and post it, what the data shows. We know that the timing of going to college or university coincides with the peak age of onset of mental health and substance use issues. We know that our youth actually have an increased perception of having a mental health issue. So whereas maybe 10 years ago they would perceive it as normal stresses, there is more an attribution to having a mental health concern. We know, and this is a really good thing, that there's reduced stigma and increased mental health awareness and more mental health literacy and more willingness to seek care, which is really good. So more people are coming forward. We know that there are some students who actually needed care and mental health access in this, secondary schooling or in their primary years, and they were unable to access it. Maybe they were in an area where there was poor access, or the family, perpetuated stigma, and they were unable to come forward. We do also know that some students who accessed care in high school or in middle school were able to overcome lots of challenges and now are entering university with ongoing needs, which is great to support their needs. We know that many students actually like receiving care affiliated with their campus. It's kind of a one-stop shop. It's usually easy. Now at the moment, lots is available virtually. We know that there's improved access to counseling on campus, often much better than in the general community. And we know that campus services are often very, very approachable, and they feel like a friendly place. Many international students, which is wonderful. Our universities have a real global presence, and they may have come from countries where reaching out was totally prohibited, and now this becomes an opportunity to do so, which is wonderful. We also know academic stress is definitely highlighted as a theme for more mental health distress. We know financial stress is a major issue, and that has become even more relevant in the last year. And then sociocultural factors and equity issues affect students reaching out for help. This is a slide just to speak to those transition issues in the system. And we know that there are many transitions, and transitions can be vulnerable times. And the age 18 is really an arbitrary number where you turn 18 and you become an adult. And we know that we need to think developmentally about people's needs. Some people at 18 are very much an adult. Some people need more support and are struggling more. And so there are a number of factors, and of course the child and adult systems are separate systems in funding and in provision, and sometimes that transition is very tough, and campus is a time where that transition is occurring. And a number of factors like preparing for that transition, figuring out if you're actually going to a new school, looking at the services available, thinking about how you would access them ahead of entering campus, doing your homework around what supports are available within an institution are all good ways to help with transition planning. This is a slide that really talks about what's happening to youth, and this is all prior to the pandemic and in Canada, and it's drawn from work that was done by one of my colleagues, Paul Kodiak, and others around data from the province of Ontario. And we see that over a 10-year span between 2007 and 2017, there was a 66% increase in emergency department visits. And this is youth between the ages of 14 and 24. And for more than half of those who were actually accessing the emergency department, it was their first contact with mental health, a provider, which is astounding and disturbing, because we know that the emergency room is an amazing resource, and a place like CAMH has an open emergency room direct entry 24/7, but it's not always the most holistic and warm and comforting place to have your first mental health contact. And so more youth are seeking care, which is positive, but they're often seeking care at the emergency room, which isn't the most desirable. And this is a slide just showing more outpatient visits, outpatient physician visits. And in fact, youth in the far right column, those are a little older, between 22 and 24, have the highest number of visits to primary care physicians. And those are the ones labeled in the light yellow. Psychiatrists are those labeled in orange. And what this slide, the take-home picture of this slide, is that most outpatient physician visits around mental health concerns for youth and addiction concerns are delivered by our family physicians. They do the bulk of the mental health work. It's really important to acknowledge it. And it's really important to access a family physician and to think about that transition piece if you're moving away from home and you're going to a new campus, a new school, to acquire a family physician that is going to assist. I always like to show this slide, and this is a slide around just thinking about mental health for students, and one could apply this to high school as well as campus. So our students and all of us have very different needs for mental health support or care. At the top are students who really seriously distressed with mental health disorders, and they really need the professional help. In the middle are those with symptoms of lower levels of distress, issues around coping, similar to the Wi-Fi diagram I showed you. And at the bottom are all students who can benefit from mental health awareness and promotion to improve our mental health. And I think sometimes we focus too much on the top, the illness, the mental illness care and treatment, which is important, and getting individual counseling, and not enough on the bottom. And we can all ask ourselves in our schools and our communities and our work, what are we doing to actually assist with our students' mental health? And today our students live in a complex world. And we need to figure out as a school, what are the issues that we really want students to grapple with? Climate change, poverty, the pandemic, the coronavirus. And we really need to sort of think about how we're contributing to student stress and distress by the way we deliver our curriculum, by the way we actually work with our students, the way we set up our learning environments, the way we build up our culture on our campus. Of course, the last year has thrown everything kind of, 180 degrees sideways. All learning's converted to online. In the school system, there's a hybrid model. In the university system, we're moving towards hopefully a lot more in person in the fall. And there was a former president of a university who said, universities are where we rehearse the conditions of a just society. And maybe we should think about where we rehearse the conditions of a healthy society. How does it apply to our school environment? This slide just really talks to that feedback loop around the intersection of academics and mental health and substance use issues. And regardless of the reasons, it can be said that the mental health and academic difficulties kind of exacerbate one another in the university setting. And often the assumption is it's the academic difficulties that lead to the mental health difficulties, which can be the case. But then the mental health difficulties can lead to the academic difficulties, right? And once the cycle kind of gets going and goes round and round, it's really challenging. It's like the chicken and the egg, which came first and where the solutions are. And often interventions have to actually address them both simultaneously. So just important to think about. This is a slide just thinking about mentorship in thinking about wellness and education. And I remember as a music student in my first undergraduate degree, I think it was like my 3rd month of my first year at school, and I was studying vocal performance, and I found it really tough. I was struggling with my technique and how to interpret what my teacher was doing with me, and I started to panic, and I was sort of went to the teacher individually, and I was short of breath and my heart was racing, and then I started to cry, and I was really, really kind of embarrassed. And it was an opportunity for this teacher to kind of check in with me and ask me how I was doing. reassured me, you know, I'm at the beginning of my degree, take a break, go home, you know, continue to kind of talk this out and get the help you need. And, you know, it was really, really impacting in that it was sort of 10 minutes of just really connecting with me on a personal level, and it meant a lot. And I think as faculty and teachers, you know, there's a lot of good we can do. There's also a lot of no good. And I think we have tremendous ability to connect with students, and small, kind, warm gestures of support really, really go a long way. So building that connection, very challenging in huge class sizes, but then there are often small subgroups, teaching assistants, many ways of direct contact that one can have. The issue of accessibility and having accessibility services on campus is one that I just always want to emphasize when one's thinking about a mental health concern or any illness concern, and how to acquire the appropriate accommodation. So definitely advocating for our students to ensure that if needed, appropriate accommodations are put in place. And this is a graph just showing a kind of a snapshot between 2007 and 2013 at one of the campuses on U of T, where there was a 41% increase in students registering with accessibility services and those who had a primary mental health disability. So previously, those who'd had maybe a hearing issue, a physical issue, a learning issue had been the bulk of those registering for accessibility services. And of late, it's primarily been mental health concerns that's driving students to register for accessibility services. So just to note that the landscape has changed, but thinking about accommodations, thinking about accessibility services, knowing where your accessibility service is on campus is a key resource. And this is again related to accessibility and inclusive pedagogy and curriculum. There was, the Human Rights Commission came out with some very key mandates in 2016 that really promote equity in education. And the one is to eliminate the mandatory need to disclose a diagnosis. So a student does not need to disclose a diagnosis. It can be helpful, but it's not a necessary requirement. For a school to provide interim accommodations when needed in the meantime, while documentation and potential assessment is underway. To accommodate in a temporary manner if something is happening in an acute sense over a couple of weeks, things can be accommodated. To consider, you know, accommodations that are more retroactive when appropriate, and to have accommodations in a central place. U of T, in each campus, there's an accessibility center that coordinates accommodations for students, and to have clear communication and training around the role of accommodations. Next, moving into a way of thinking about care that U of T is certainly adopting moving forward, and many places are, and it's thinking about mental health supports in a stepped care model. And basically, it's matching care along that continuum to meet students where they're at with a wide range of needs, from early intervention, mental health literacy supports, drop-in peer supports, moving forward into more intensive intervention. And for intervention to be timely and accessible and easy to access, and really for youth and students to be engaged and actually to be working integrally in the development of mental health supports and services, so that youth are really speaking to what the services and supports are. To measure supports and services in a way that we can determine if they're doing, you know, if they're helping or not. To really have a strength-based approach to supports on campus that is also recovery-oriented. And this is a model, one model called Step Care 2.0 that has been adopted by the Mental Health Commission and many campuses. And it really shows you from light blue to dark blue the range of supports along a step. This is a 3D model. So looking at online self-help tools, looking at peer support, which is an incredibly helpful intervention, where you can have individuals who've maybe experienced a mental health concern, fellow students. There's a various array of peer supports that can occur. Instructional workshops around key coping mechanisms, key concepts that are available in online modules. You can do them in your own time. Group work, group programming, brief counseling, drop-in counseling, one-at-a-time counseling, and then moving into the dark blue areas with supports geared to people with more acuity, with more emergent issues, and with more longer-term issues, and being able to support that. Some of the top end of the continuum would be best done in partnership with community supports, with hospital supports, not on campus alone. This is just a slide to talk about how we've really been working at U of T around what we call interdisciplinary integrated care. What does that mean? It just means that a family physician and a counselor and maybe a psychiatrist, maybe a dietitian, all work together around care that is connected. Not necessarily all providers are involved in every student's care, but there's an interdisciplinary connection, and students can access supports in an interdisciplinary integrated manner. And on campus, sometimes with correct consents, there would be a connection to an accessibility advisor, or there may be certainly a player who would be very important would be a registrar, not necessarily connecting directly with a healthcare team, but a very important support person, or a dean of students. There are various people in the campus environment who are very helpful in terms of mental health support and awareness. And this slide just alludes to the fact that many campuses over the last probably 10 years have been developing mental health strategies. The bottom one is the U of T one. The one on the top is the McMaster one. Pretty much every campus has a mental health strategy. And we put out a strategy a number of years ago, and we're now in the midst of a fully developed sort of implementation of our mental health task force. And this is ongoing and has started up in the last year. And this came as a result of really wanting to, excuse me, do a deep dive into ways we can, as an institution at U of T, support our students in a very inclusive, holistic manner across that whole continuum. The task force is working actively as we speak. It's working on some key priorities. There are many. Some of them are simplifying things for students so that it feels really easy to know where to go for help and how to access it. Building those mental health literacy competencies, not just in students, in staff, and faculty, in all areas of campus. Looking at what we call promoting mental health across the campus in culture and in the way we deliver curriculum. Certainly increasing the diversity in our providers, in our staff, in our faculty, having a real diversity lens, which is really incredibly important. Building crisis supports and links to our partners, be it CAMH, be it other hospitals, be it community crisis supports. And partnerships in general. We can't do this alone as an institution. No campus can. So those are some of the priorities from the Mental Health Task Force. Moving a little bit into the issue of COVID and mental health. And, you know, broadly, not just our students and our youth, there have been many stresses associated with the last year. That really have contributed to global emotional distress and definite impact on our mental health. And just to list a few, I mean, insecurity, feelings of confusion, feeling lonely and disconnected with quarantines and lockdowns, social loss, certainly in our youth and in our students, the lack of just fluid, flexible, being social, being with friends, certainly financial loss to many in our community, work closures, losing work, being without work, school closures, and lack of resources with just, you know, some of our health planning has been, it's been a challenge, right, to deal with this incredible global process. And it's not surprising, because we know that in other economic crises, in the SARS crises back in 2011, there was data that those most severely affected, it was much briefer, had issues with sleep, had issues with sort of leaning more towards substance use, had mood and anxiety issues, and even had issues related to trauma. And there's a lot of research showing that in disasters, and COVID is certainly one, feeling emotionally distressed it's everywhere. It's ubiquitous in all populations. And it's actually very normal. But there is a tremendous resilience in us as a community, being able to recover from something like that many of us are able to find new strengths and new opportunities. And we do need to think about the whole phrase of "we're in this together," which was the WHO mandate. And we need to really think that we are in this together, but we're not all in it equally. Actually, many of us, some of us, are more vulnerable than others. I may leave some out, and it's not intentional, but some of the groups that are known to be more vulnerable are women with families, those of us who've lost jobs, students who've had to shift, those with children at home who've had to kind of really reorg, those who have lost family members to COVID, those who fear losing family members, those who are grieving. Children, younger people, and youth are at a definite risk. Just the whole sort of area of development, I mean, showing new transitions, and a year in a young person's life is a very, very long time, having to adapt. Those who are at risk of violence in the home. There is some emerging data that shows that there's increased rates of domestic violence in this past year, which is very, very concerning. And the social determinants of health, you know, income, how supported you are, how educated you are, how employable you are, your own innate biology, your access to health care, your gender, your culture. Those of us who are racialized are known to suffer more significant health deficits. Our Indigenous community is definitely more at risk. Our elderly, our BIPOC community, those with disabilities, those who are newer to Canada, those who live in more crowded housing, all more vulnerable. So COVID has increased the risk of negative, you know, health outcomes, but it's also highlighted the pre-existing inequities in accessing healthcare. And most Canadians who are struggling with their mental health due to COVID are actually just experiencing a normal stress reaction. And there are available mental health resources to cope. I know it was listed, you know, that I would list some of them. It really depends on where you're situated. Our government has developed a Wellness Together framework. And if you actually go onto the COVID Ontario website, there are, for instance, there's free internet-based cognitive behavioral therapy available to everyone through two organizations, Mind Beacon and Mona Chappelle, called Ability, which is great. And there are lots of virtual tools available. And then, of course, working to access often your primary care provider at first, or looking at what virtual drop-in counseling is available, depending where you're situated. The virus itself, you know, there's lots to explore, but the thinking is that the virus can impact one's focus, one's mood. There's a tremendous sort of syndrome being described where people are more apathetic and tired with memory difficulties. And then there are students, and I'm just going to go forward. This is an American College Health Survey, so done in the United States over the first few months of COVID, and 66% of students reported increased financial stress, 60% reported increased difficulty accessing mental health care, and 41% witnessed racism behavior online or in person. This was in the first several months of COVID. It's very concerning. And our students, you know, their natural university experience over the past year has shifted. Often their living context has been displaced. They've had to move back to, you know, either the family home or they're living on campus or off campus in a very isolated manner. Their opportunities for being independent, for mingling, for living in the moment, for kind of just experimenting, which is all part of being a youth and a young college student, has been shifted. And the learning format, not to mention, that's a whole talk in itself, has shifted to online. So, you know, we do need to think of an ongoing focus on mental health. COVID has highlighted that even more. We can't let our guard down, and there is so much work to do. And actually, I just want to show you this slide, a little bit out of order. This is a slide that just sort of shows the inequities of the social determinants of health and the inequities in terms of what people are experiencing. And it was a poem by Damien Barr last year that went viral. We're not all in the same boat. We are all in the same storm. Some are super yachts and some just have the one oar. And it really speaks to those issues. I can read you a little bit of the poem. It's really good. I don't want to read the whole thing, but we are going through a time when our perceptions and needs are completely different, and each one will emerge in his own way from that storm. It is very important to see beyond what is seen at first glance, not just looking, more than looking, seeing, and see beyond the political party, beyond biases, beyond the nose on your face. Do not judge the good life of the other. Do not condemn the bad life of the other. Let us not judge the one who lacks as well as the one who exceeds him. We are on different ships looking to survive. Let everyone navigate their route with respect, empathy, and responsibility.